We are now recording. Welcome to A Mindfulness Experience. With access to Integrative Medicine Health Institute, the GW Office of Integrative Medicine and Health, and the GW Resiliency and Well-being Center. AIM is the first 501c3 nonprofit in the DC metro area to provide integrative medicine services to low-income and terminally ill patients, regardless of their ability to pay. The office is a global leader in integrative medicine, focusing on professional development and community outreach events like this one. The center takes an evidence based whole person approach to the health, wellness, well being, and behavioral services that it provides exclusively to the GW medical enterprise. Um, Sometimes we do things for the School of Nursing, and sometimes we do things with the School of Law, but most of our focus is providing help to SMHS, GWMFA, and GW Hospital and Children's National. Today we have with us Dr. Mikhail Misha Kogan, who is the founder of AIM Health Institute and the Chief Medical Officer of the GW Center for Integrative Medicine, or CIM as most of us call it, and Catherine Miller, a certified health and wellness coach and mind body practitioner with Four Directions Wellness and CIM, where she provides Reiki, yoga, and nutrition counseling. Catherine has her 200-hour yoga teacher certification from Kripalu, and she has certifications in Yin Yoga, Divine Sleep Yoga, Nidra, and Mindful Resilience for Trauma Recovery. So, Misha, tell us what's going on with our quademic.
Right. So, I think I'm caffeinated enough to withstand the barrage of expected questions, which I already see some popping up. That's good. I also, of course, you're all following the total craziness with what's going on with the availability of vaccine. Now, government claims that vaccine Moderna is increasing mortality in pediatric population, which of course it's a BS. There's no such thing. It's all politics. So, they're seemingly like, we're faced with a very stressful times in terms of how we should be looking at this. So I'm going to try to dissect this a little bit for everybody. So first of all, let's talk about the COVID shots, what's currently available. If you're in DC and Virginia, you're probably going to need a prescription. If you're in Maryland, or if you just want to not bother your doctor, go to the Maryland. Apparently, you will get your shot. A couple of hours ago, somebody asked, which shot should I get? I say it really doesn't matter. We used to think that maybe there was something better with Moderna. Some people suggested that Moderna was slightly more efficacious. I don't think that there's enough difference to really think about this. I will tell you one thing. If you had one vaccine and it caused significant allergic reaction, and you're still considering get the other one. That is the one critical aspect. So if you had any negative reaction and you didn't like it, whether it's an actual allergic reaction or you just had a really bad reaction, consider getting the other one. And definitely get the prep protocol that we talked about last Friday. If you don't have the prep protocol, we'll make sure we post it in the recording of this video as well. And you can always email me and I'll send you, or I can even order the protocol for you with the discount or the full script. It's very easy. You take one supplement that lowers histamine response called natural dehist. You take it starting 24 hours before the vaccine, and then you take 3 homeopathics mixed in a bottle of water, shaken really well, and you take first dose immediately after shot, second dose 30 minutes later, and the third dose 2 hours later. So the protocol is very simple. I've had a lot of really good responses to it. I think, of course, it's not necessarily evidence-based, but it makes a lot of sense. And please don't take antihistamines when you do take the shots. Do not take any Zyrtec, Claritin, all those things. They're clearly decreasing efficacy of vaccines, and they've been strongly not recommended. If you have to take something for side effects, just take Tylenol. That's probably the safest thing to take. Okay, so I don't have any other updates on COVID. There doesn't seem to be any major differences. California is in the thick of it. They continuously going upward, so they haven't plateaued yet. From my understanding, our area plateaued, so we're not seeing more cases, which is kind of nice. Will we go down? I hope so. We could also potentially stay on a kind of a mild to moderate plateau for quite some time, and that's also possible. So let's do the questions. Question number 1 from Linda. I heard that you have to wait a month between COVID. So yeah, a month would be ideal. The problem right now is that apparently flu is already here. So usually I recommend getting flu in late October or even November flu shot, just so that it lasts into the next year longer. But I'm changing my recommendation for this year just because the flu arrived sooner. So I think it's okay to shrink the time to 2 weeks. So if you are planning to get COVID and in the next, say, week, get a flu shot after 2 weeks later. I would get a COVID first just because I think the numbers are definitely towards COVID. COVID is much more prevalent at the moment in our area compared to flu. Flu just beginning. It's not even clear how much flu we will get, but we will have to obviously see. I don't know what to tell you about that. And the reason I don't recommend them together, if you're wondering, if you look at, there's one study looking at people over 65 when the two vaccines were given together, there were definitely higher risk of side effects when that happened. And some of the side effects were pretty significant. We're talking about strokes. So I don't recommend getting the two shots together, no matter what CDC says. Remember, I had a lot of disagreements with CDC. They're unique disagreements. They're not necessarily in line with some other organizations, so I will be covering each disagreement separately. Now, if you're much younger, probably combining is just fine. I have not seen any evidence to say that younger people cannot combine two vaccines, so you use your judgment. I don't tolerate flu vaccines. I get a horrendous fever over 102 for up to a week. I don't know whether it's some allergy or it's just strong immune system. So I actually never get a flu because now I can't work, and I can't work for a long time. And so I choose to wait to get a flu. And I had flu a couple times and it lasted for 2 to 3 days. So I just take a flu basically. If it happens, I isolate myself and call it a day. But everybody's individual. If you're tolerating flu shots well, go ahead and get them. Okay. So RSV. Okay. I look at RSV a little differently. I think I answered this several times, but it's fine. I'll answer it again. If you're relatively healthy and you're somewhere under, let's say, age of 75 or 80, and you don't have any pulmonary disease, I don't recommend this vaccine. I think while it does increase risk of some serious complications, the problem is there's very little known about this new vaccine. And especially given the sort of situation that the flu and the COVID come all together, combining all these vaccines together until we have a safety data, I'm not doing that. And also, I have not seen the data in all comers to see a dramatic increase in mortality. In fact, flu has a higher mortality compared to RSV in non-pulmonary chronically ill patients. So if you don't have a pulmonary condition, you getting a flu is going to be more toxic to you and more complication prone than getting an RSV. RSV in a even 65 or 70-year-old person without lung problems comes in as a relatively typically mild bronchitis-like picture and goes away after a few weeks. It's very different if you have a chronic pulmonary disease, if you have COPD, if you have asthma, if you have pulmonary fibrosis, interstitial pneumonitis, or any other of those chronic pulmonary condition, you should be getting RSV, and you should definitely be touching base with your pulmonologist, ideally, to discuss what else you could be doing to prevent this. RSV in that population is severe and is problematic. So those patients, I would recommend getting everything, COVID, flu, and RSV. How to space it out becomes quite individual, so I don't think I can comment in general here because it gets too complicated. All right, let's move on. And by the way, if I didn't answer questions significantly, you have two choices. Raise your hand or just write something so I know that it's in reference to your first question. Okay, in an article in yesterday, Post said that CDC would vote today to make it harder. Yeah, not going to happen. I mean, they can do whatever they want. They're not going to be able to push against Medicare and make it really hard for people. There is definitely uptick in the cases. I don't expect that this is going to happen. I think it's all politicking. I think they're gonna put out a lot of statements, and I would assume that close to 100% of them are gonna be nonsensical. They're just gonna, in essence, they're just going to mud the water with every statement. They're gonna make everybody be more stressed. Gonna make everybody less clear what's happening, why it's going on. We all quite know why it's going on. Again, we don't talk politics on this channel. I'm just giving you practical information about how you should be thinking about it. I don't think it's going to change anything with the access. I don't think it's going to change anything with the data, with should you get it or should you not get it. So stay very attentive and do not respond to the statements followed that are coming out of the political offices. And be very careful with CDC statements because obviously, as you know, CDC is now fully under the control of the government. So I don't believe anything that's coming out of the CDC anyway nowadays. So I double check, triple check, and then make my own recommendations. So do take into consideration. Now, if you're still following CDC guidance because you like it, that's fine. But again, I recommend for you to really be careful and keep an eye and see what science they're using to support these statements. That's probably the most important statement. So I don't know what that means to say compromised breathing. I don't understand that statement, Randall. So you have to clarify it. I don't know what that means. Compromised breathing on a chronic basis means some kind of a chronic lung disease. Then of course that's the category which should be getting you probably should be getting RSV vaccine. But I'm not sure what that means. If you have, for example, sleep apnea, I don't consider that compromised breathing. If you have some kind of a nasal anatomy change, and you're breathing a little different, that doesn't necessarily mean you're much more prone to some lung infections, but I would need to know exactly what you mean by that. Okay, New York Times recommended older people get COVID vaccines soon, like this week's, due to worries about what this panel is going to decide. No, I disagree. I agree to get the vaccine soon, but not because of the worrying that they're not going to be available. I don't believe that. I think the reason to do that is because the COVID is right now in an uptick here. And we know it's a new strains. We know that those strains are not covered by old vaccine. So makes sense. This week, next week, whatever. And by the way, my understanding, and anybody please correct me if I'm wrong, but I hear that the old vaccine has been removed from stockpiles completely. So whatever you're going to get right now in the pharmacy is going to be the new and updated version. So the old ones is already all retired. So I don't think that you need to worry about that. Okay, this is a good question. Not that other ones were not, but I'm just specifically think this is the more difficult question, so I'll try to answer it. From Linda, if you have a long COVID symptoms that didn't do well with last COVID, should you take the flu shot? So notice that the question is not about COVID vaccine, because presumably you shouldn't be giving COVID vaccine if your prior one caused worsening of the long COVID. We do see this all the time, by the way. And so in that case, it becomes very challenging conversation, and it should be individualized with your provider who takes care of your long COVID. Why? Well, because getting COVID potentially is even worse. So you have to make that decision. Are you going to accept the risk of COVID or getting another COVID, or are you going, or what? Or you will take the risk of vaccine, or you're going to try to somehow prevent COVID without the vaccine. So the flu shot is very interesting. So I think the flu shot, the way I would answer this goes like this. If you know your immune system is super sensitive, and every time it has any particular small challenge, it goes haywire, I wouldn't take the flu shot. I would take my risks with flu. Because we know that if you get really sick right now, and you actually potentially going to get predisposed to all of this at once, RSV, flu, and COVID, because your immune system is going to go haywire, and that may not be a good thing for you. So that's one. If you did okay with the prior flu shots, if you don't have a super high sensitivity to older vaccines, because remember, flu vaccine is not an mRNA, it's an egg-based. Most people tolerate it really well. It's not as much of a conversation. Then I would definitely consider getting it. Why? Again, for same exact reason, because likely the infection is going to cause more problems than the shot itself. And flu, especially severe flu, has been associated with worsening of long COVID. There's data on that. So in that sense, you should probably be getting a flu shot if you know you can tolerate it. So I hope that answers this. Neuromuscular impairing pulmonary function tests. All right, Randall, this is a too sophisticated problem to try to answer it here. I think you're going to have to talk to your pulmonologist because I don't know how to answer that. It's a very specific issue. It's very uncommon. I presume the answer is you should be getting maximum protection, including RSV shot. I'm guessing that's what your pulmonologist is going to tell you. Is that true? I don't think I don't know the situation enough, and there's going to be no science to guide you. There's going to be no studies on your condition comparing vaccine versus no vaccine and seeing what's going to happen. I can guarantee you that just because it's not a common scenario. Maybe there's some data on a flu, but definitely not on RSV. RSV vaccine is very new. They've only had few trials on it, and it'll probably do more, but it'll take time. So you're going to be on your own being guided here, unfortunately. So no, so it's not true. The current strains that are circulating are not more virulent. Great question. Thanks for bringing this up. They're more contagious. There's a big difference. Contagious means that you're more likely to get it. That's why we're an uptick in most of at least in some parts of the country. But it's not more virulent. So the disease is not more severe. There's been some initial concern about strain that's not the one that's taken over here, but the one that's still heavy in West Coast, which is not the current one, Nimbus. The one that's in California heavy is a Nimbus. So there was initial suggestion that Nimbus was more severe, and it seemingly was correlating with the number of admissions to the hospitals in California. But when they actually did the exact math, turns out it's about the same. It's just there are just more cases. So more cases means more hospital admissions, not because it's more virulent, just because there's more cases in total. So no, in fact, if anything, my prediction is that all these strains are less virulent because they're more contagious. There's typically, this is what happens with this virus. As they get more contagious, they lose the virulence. So that's kind of a slightly good news. Although, frankly, I don't think it's such a significant difference that we need to think about that. Okay. COVID shot first, simply because flu is still not heavy here. That's the only reason. Is COVID recommended for children? No. So government made it very clear they're refusing to even pay for these vaccines for children. And you've seen what just happens, right, with Moderna? Apparently, CDC put statement today that Moderna killed more kids than not getting vaccine. So now there's this whole cahoots, and it's possible that there's, if you look at the market, Moderna just lost 10% of their stock overnight because they basically market is feeling like Moderna vaccine is going to get disapproved by FDA. For at least for pediatric population, because they claim that it kills kids. Literally, that's what the government's stating. So in that, and I see if the child is healthy, I see no reason to vaccinate them with the boosters at all. There's really no data for this age. Now, if the kid has a lot of any kind of chronic illness, this is not applicable. You got to go talk to the pediatrician. It's different. I'm talking about completely healthy 8 to 13-year-old kids. Presumably they all already had a first rounds of vaccinations. Most of them had some kind of a COVID sooner or later. So no boosters for that age group. I say just, All right, so I have one topic since I don't see any more questions, which is kind of in line with Catherine's work, but it's also in line with the podcast that we just recorded. So hopefully Janet has a minute and she can give us the link to the Scott's podcast on ketamine for mental health. But what I want to talk for a couple of minutes is more broad. So I just want us to talk a little bit about mental health and how I think about some of the things that we should be doing for ourselves. I put a copy to the video if you're interested onto the YouTube, but of course, by all means, again, Janet, hopefully we'll put the link to the actual podcast if you prefer sound, just the sound. You can listen it on your favorite podcast app. So, we have crazy amount of stressors in the moment. We're under a situation where to me, it feels that things are very unsettling, not necessarily only because there are all these issues we just discussed with politics, but also because there's seemingly a constant backward trend on things that are really important for me. So I am extremely aggressive about the point that we're all under a massive increase of toxicity exposure. Our environmental controls have been stripped. In the last 5 to 10 years, I see a dramatic increase in the total amount of toxic cases that I see through my practice. And to me, toxicity is a stress. To me, toxicity is one of the core stressors, and it tends to create consequences that are broad. So you may be dealing physically with a toxin well. For example, your liver may be very robust, your excretion pathways are very good, but don't get fooled. Any toxin will stress your central nervous system one way or another, whether it's a biological toxin, whether it's a toxic boss at work, or a toxic relative at home. You know who you are. I'm thinking about myself, so don't worry about that. I'm not thinking about anybody else in particularly. But we all have those people in our lives. We all know who they are, right? So it doesn't matter what the toxin is. Your central nervous system in some ways regulated according to that universally. The negative response to the chronic significant stressors internally is the same. The only thing we can truly do is to mitigate it, right? So we can design the tools in our life that will protect us to some extent. So the reason I'm bringing ketamine is because it's a very universal tool. And I don't necessarily mean ketamine is the must. What I'm trying to say that altered state of consciousness, whether they're achieved through the retreats, through the meditation, or through the drugs, as long as the drug's done not in a recreational format, but in a highly supervised psychotherapy-like format, what we often call psychedelic assisted therapy or psychedelic assisted psychotherapy. As long as it's done in that format, I do see them being equally effective, if not sometimes more effective than many other methods, mostly because they tend to work fast. If you look at things like meditation or retreats, you have to commit to the path sometimes for decades, not even for years, versus medications or other substances, natural substances like psilocybin, for example, they can shift our stress response instantly within just hours, if not minutes. Why that happens? Well, our brains are quite adaptable. And when we change the way our natural thought processes occur, when we bring that up, when we shut down our analytical capacity, and what comes in is the kind of this more subconscious, deeper state of awareness, when we up that up and when we bring it to the forefront, generally what gets fueled afterwards is therapeutic. That's what we've seen. There's lots of work done on this topic. I strongly recommend, if you're interested in this whole field, definitely listen to the podcast, because Scott is like the #1 guy in clinical practice, and he's one of the co-founders of Integrative Psychiatry Association. He's been doing this for a very long time. He's been my teacher when I was in medical school. So I'm honestly quite honored that now I can interview these people more like a colleague, not as a student anymore. So Scott, and I remember Scott back from my 4th year of medical school when he taught in one of the courses I attended, elective course, and I had a very powerful memory of him. He's one of the most grounded people I've seen in terms of how he handles this whole idea of spirituality, and how should we be getting there, and how does that impact our being here and our personal response to chronic stress. So he's very wise, and you'll have a lot to learn from him. So now, if you don't want to consider medications or natural psychedelics as any route for you, that's perfectly fine. As I said, there's lots of other ways to get there. One of my all-time absolute favorite reads on this topic, which I think you all will benefit, is Altered Traits. So I'm going to give you a link, and that's written by one of the very famous neuro researchers, Davidson, and I'll put the link. It's on audio as well as in text, so whatever you prefer if you buy your things on Amazon. So it's written by Daniel Coleman and Richard Davidson. Richard Davidson is head of the University of Wisconsin Mind-Body program, and that's the program that studies Dalai Lama and a variety of different Tibetan monks who've been meditating for decades. And so Davidson's principle in the book, or kind of a main message, is very direct. He basically says, look, sitting down for 30 minutes per day to meditate is wonderful and it will help you, but it's not going to change your brain. It's not going to ultimately provide this profound protection against everything that's happening to us. If you want to get there, not only you have to put a lot more hours, but you really have to pull yourself out of your daily existence. And basically, he says retreats is the must. That's what his claim is. And interestingly, why am I so big on this topic? When I was in medical school and even before, I stumbled upon some of the Sufi work and did a lot of retreats early in life, and then co-led a lot of retreats. And I will tell you, for me personally, one retreat is worth than a year of meditating daily. And why? Because when you're in that completely shifted space for, let's say, a day or two, the amount of change that occurs suddenly and the way I can hold on to this change is profoundly deeper than when I try to do a little bit of a shift every day for half an hour or even longer. And that's the book is basically explaining why exactly this happening on an anatomical and physiological level of a brain function. So if you're interested in that level, the book is for you. If you just trusting my words, that's fine. So by the way, with that, we have another opportunity. Unfortunately, this is not free opportunity because we have to run this a bit more complex. So I'm going to give you a link. We don't have the registration right now to this event on the Eventbrite, but we have it on Facebook and LinkedIn. So I'm going to put this to links to the Facebook and also to the LinkedIn. And if you have any questions, you can message me or Stephanie. Stephanie is a retreat coordinator for this event. And this event is led by Dr. Frame and I at the small cabin. So we're only going to take up to 6 or 7 people. So it's very, very limited space. It's a weekend, first weekend in October. So I hope some of you will consider joining. And of course, we're going to explore this space of retreat quite in depth. And yes, Dr. Frame just finished her yoga training. So there will be not just talking, there also going to be movement practice that will be guided by her. Yes, weekend long, a weekend of Tai Chi retreats. It doesn't matter what retreat is, even if your retreat is going to a metal rock concert, although I'm assuming that can have some negative consequences to your hearing. But the idea is not whether you're going, into some Kundalini state or some really far. That's not the point. The point is intentionality, getting out of your typical exposure and engaging in something that lets your brain to operate slightly different. And that's the trick. And when you do this in the retreat settings, you tend to go a little bit deeper because you're committing to that period of time fully. You're not on your phone, you're not cooking your meal, you're not getting disrupted by the phone calls from the neighbor or police car passing outside. You're more protected from this, surroundings factors. But I get my message that Catherine's time is up. Catherine, thanks so much for joining. It's always such a pleasure having you. So take it over.
Thank you, Dr. Kogan. Can everyone hear me okay?
Yep.
Okay, wonderful. Speaking of meditation, as was shared at the beginning, I teach and do yoga, or sorry, yes, yoga, but also Reiki sessions with Four Directions Wellness. And I thought, if everyone's okay with it, I wanted to lead you all through a holy fire experience, a holy fire Reiki experience. And so I can give a little brief explanation of what that is and what we're going to be doing. For those of you who aren't aware, Reiki is a form of energy healing and work. It can be done hands-on or hands-off the body, and we used to do it actually at GW Hospital for patients, their family members, and staff. And we saw a lot of progress in terms of pain relief, relaxation, help with sleep, and countering, high emotions. Holy Fire Reiki was just a new form of Reiki that was introduced a little over 10 years ago or so that they say is like a more refined energy. But there is an ability for me to kind of lead you all through a meditation. And so you can each experience any type of healing that it is your body may need or want at this time. Reiki works on the physical, emotional, mental, and spiritual levels of our being. So while you may not necessarily, it may not be the same as having a specific one-on-one session, right, where maybe you're there for pain relief, you could feel those benefits. Some people feel or see visions, colors. Other people feel energy flowing through them. Some people just feel very relaxed, which, as Dr. Kogan noted, things are very intense and high stress at this time. And so any bits of relaxation maybe that we can experience can be very meaningful and produce benefits for us. So if that works for folks, I wanted to guide you all through a session. I will lead you through a guided visualization, and then I will actually stop talking for about 15 minutes to let you fully experience whatever it is that the Holy Fire Reiki brings up for you. You can be seated or you can be reclined or laying down, and you can also change positions during this experience. If you want to play any music on your end, you can. And during the about 15 minutes of silence, some people kind of like drift off or fall asleep, and then they kind of come back too. So just wait until you hear me bring everyone back, just remaining where you are, immersing yourself in the experience. So with that, I invite you all to go ahead and get yourself settled. Okay. So take a moment to, again, you can be seated, you can be reclined, you can change your position. If you want to get any blankets, pillows, anything to help you feel more comfortable, you can. And again, I'll give you all about a moment or so. And whenever you are ready, I invite you to close your eyes or hold a soft gaze forward. This is the ocean of holy love experience. Again, you can close your eyes and take a couple of deep breaths in and out, in and out. It's a beautiful day, warm and sunny. You're walking down a path in a beautiful forest. As you breathe into yourself, you breathe in the life energy of the forest. And with each step that you take, feel the energy of the earth flowing up through the bottoms of your feet. As you walk along, you notice up ahead it is getting lighter, and that you are coming to the edge of the forest. As you walk out of the forest, you notice the path is getting sandy, and you hear the sound of the ocean. Walking out onto the beach, the ocean is before you. It's a wonderful day, and slowly you begin to walk along the beach. As you walk along, you notice a log has been washed up on the beach, creating a nice place to sit and lean up against. Go ahead and sit and relax against the log. This is no ordinary ocean. It is the ocean of holy love. Listen to the sound of your breathing. And imagine it is the sound of the waves washing up onto the beach and then flowing back into the ocean. The ocean of holy love is guiding you. Follow the guidance. You can continue with your experience as long as you feel guided to do so. Whenever you're ready, I invite you to take a couple of deep breaths in and out through your nose. Bring your awareness to your eyes. And slowly open your eyes and come back to our space together. If you'd like, you can take the next couple of minutes and journal or jot down any notes or write about what came up for you during this experience. If there was anything in particular you want to capture or reflect upon. If not, I invite you as well to just sit and be, knowing that whatever came up for you, whether you were cognizant of it or not, is all intended for your healing and highest good. Thank you all for allowing me to guide you this afternoon and for trying something new. If this was your first interaction with Reiki or Holy Fire Reiki.
Thank you, Catherine. This was delightful, as always. Always such a pleasure having you. So maybe if anybody have any last minute question for you, you can drop it in a chat. And just also, I will actually, Catherine, why don't you, if it's easier for you, put the link for your own practice, and then I'll put the link for your page on our website, so that if people want to reach you, then they'll have links. So this is Catherine's first, is her own practice with Mara, and then also I provided link if you want to take a look at Catherine's page on CIM website. Right. Janet. Yep. You read my mind. That's nice. All right. So Nancy Cadian is my, sometimes we call her DC mother. So that would be good to have her. She's a firecracker. I think you're going to like her. She has a very unique way of teaching mind body, and hopefully you will appreciate it. And it's a still hot topic with COVID, so please prep your questions for next week. I'll try to catch up, and anything else happening in this crazy world in between. If you came a little bit late, let me put the links to 2 upcoming events. So one is Dr. Frame and I leading the retreat, first week of October, and tomorrow we have a free offering. It's called Beating Heart, the Beating Heart, the Science and Mysticism of Health. And this is an event where I co-teach with Dr. Talasek and Fred Johnson from National Academies of Sciences. Hope to see some of you there. Otherwise, we'll see you all next week. Very good showing today. We hit 40 people. It's quite impressive. So if you're my patient, I see Salome has a hand. If you're my patient